Welcome, I'm Mark Regan. I'm the MEP Director, responsible for the delivery of the Midland Metropolitan University Hospital.
Hello, my name's Rachel Barlow. I'm the Director of System Transformation at Sandwell and West Birmingham Hospital Trust.
Today, by means of a progress update, we're going to show you some of the fantastic work we're doing on their hospital. We are currently 9 months into a 27-month programme period. We plan to hand over the hospital to the Trust in spring 2022.
Today is the first of a series of clinical pathway videos where we're going to show you around the new hospital, following the pathway a patient will take in the future. Today we'll be looking at a patient who arrives by ambulance in our emergency department and the route they will take when they're admitted to one of our wards.
Welcome, my name is Dr. Saab Clare. I am the Deputy Medical Director and Acute Medical Consultant at Sandwell and West Birmingham NHS Trust. And today we are going to talk you through a patient's journey. So if you are acutely unwell, this is what will happen to you.
My name is Daniel Warren, Project Manager of the Acute Main Floor.
The acute main floor contains the emergency department, radiology, cardiology, the acute surgical assessment as well as the acute medical assessment unit. We are currently standing in the ambulance bay. The ambulance bay can carry 22 ambulances, and this is where handover will happen and when you will come if you're acutely unwell. Please come with us. So, once you arrive, if you need an urgent scan, for example, if you've had a stroke, you'll be moved promptly to our radiology department where you'll get urgent scans. If you need urgent medical treatment and are very sick, you'll be moved to our resuscitation department and be seen promptly by a senior doctor and nurse. If you've had a heart attack, our heart doctors will see you instantly and you'll be moved down that corridor to our acute cardiology service. We are now going to walk you through the resus department and take you to the ambulance assessment area. Come with us. So here we are at the ambulance assessment area. It is here you'll be seen by a very senior doctor and nurse where they will decide where you need to be seen. You may well go to minors, majors, resus or even ambulatory care.
Within this area we've completed the first side boarding and in-wall services and are due to second side board at the beginning of November. Over here you can see services high level such as medical gases and the sprinkler system.
So here we are now standing within our 10-bedded resuscitation area. This is an example of a resuscitation bay.
Here we have a room reference code. With this QR code and an iPad, we're able to monitor the progress of each construction phase throughout the room. By scanning this code, we can monitor quality and any issues.
So here we are in a 6-bedded bay in the acute medical unit. The acute medical unit is a very large unit which will look after acutely unwell medical patients. It houses 108 beds and you will be seen by senior experienced nurses and doctors 7 days a week.
Within this area we've progressed quite well with the first side boarding and also the high level services with the ductwork and drainage.
If you need to stay longer in hospital than 48 hours, you'll be moved to one of our specialty wards. We'll take you there now.
So, welcome to one of our wards. Our wards have 32 beds and half of the rooms are single side rooms. We're in an area now where there are 4 single side rooms. Each room has an ensuite bathroom and toilet and will be fitted out with a call bell where patients and staff can talk to each other and communicate. There's also some fantastic windows in this building, so every single bed space has the advantage of really good light coming into the room to help patients orientate to the day and night. Our colour scheme, once complete, will be dementia friendly to help patients find their way around our large wards.
So this is the West Ward on level 8 and we're just at the stage, as is down in clinical, where all ducting has now been completed. We started to fit pipework, sprinkler systems. Once all this is installed, we can then start the second sideboarding and start completing walls.
Let's take you now to one of the 4-bedded bays elsewhere in the ward.
So this is outside, a typical 4-bed bay. This is the nurses' station where the nurses will be situated, being able to keep an eye on the patients.
So these spacious 4-bedded areas will be specifically for single gender patients. There's a bathroom facility in each area that's easily accessed. The wards will all be standardised to enhance patient safety. So from a staff's point of view, the resuscitation trolley, the sepsis box, the drug cabinets will all be kept in exactly the same location throughout the building, meaning that staff that move from ward to ward will be able to function in a safe and effective way.
We're now stood in the Winter Garden, a purposely designed fantastic space, so designed to enhance the experiences of patients and their family when they use the hospital. We have been working with the West Midlands Constructions Authority, Sandwell and Birmingham councils in our drive to employ local people. We have also been working with the Sandwell ambassadors in our achievements to engage with the local supply chain.
This wonderful facility makes this more than just a hospital. We want this to be a really vibrant community space that's used not just by patients and visitors, but by our local population. There'll be facilities here for pop-up businesses to work, for the voluntary sector to come in, for patient groups to meet and socialise and relax here and support each other. So for us, this is much more than just a hospital. We think this is a massive investment for our local population to enjoy.
So thank you for your time today and joining us on our journey around MMUH. Our journey as Balfour Beatty started in December 2019 when we was awarded the replacement contract. We started on site in January the 6th, 2020. Have expended 500,000 hours to date through 500 tradespersons, 56 different contractors. We're pleased to be delivering with the Trust this fantastic building and look forward to joining us again on our next journey.
So, we hope you enjoyed the tour of the hospital and we look forward to seeing you again soon. Thank you.